I spend a lot of time talking to people about healthcare costs. And so once again, I'm going to use this scenario to give you an idea of how we are currently arranged. So as a nation, we seem to feel that our employers are the primary route of access to health insurance. And if as a nation that's how we feel, then we're not necessarily set up to understand what our full costs are. For example, anyone here have children or grandchildren? Okay, so you go to the supermarket with your kids. There's no investment in it for them at all, right? So if they say, I want this, I want this, I want this, can I have this, can I have this, can I have this? It doesn't cost them anything. They might actually get something, right? So it's a very childlike purchasing, but you're sitting there with a lot more information and you say, you know what, I have to go to work every week. I bring home this much money every week. This is how much money I have. So I have a finite amount of money. I can't buy all of these things. But you know what, since you've pestered me for 400 questions, I'll buy this one thing, just to shut you up. Okay. Now you take your children, they got their birthday money. They got $25 in real cash. And you go to Toys R Us. You will be there for 7 hours. Because it's their money. And they think about their own money very differently than they think about your money. And our employers are paying for our premiums, and we think about it very differently than when we pay for our premiums. And we ask for a lot because it doesn't really cost us anything, so why not? We have a very childlike system set up right now, and when I meet an employer that pays 100% of the premiums, I tell them, you're basically raising some spoiled brats here. One day, you're not going to be there, and they're going to have to learn how to buy health insurance and how to do this on their own, and you've got their expectations set so darn high that it's going to be a crash to the ground, and they may choose not to have insurance, because if they ever leave this job and they get the COBRA and for the very first time they see how much you're paying, you could crush them. You're not doing them any favors by having your employees completely disengaged from the buying process, and you're not doing them any favors by not giving them the tools to control their costs. For example, there are programs out there like telemedicine. So what telemedicine is a doctor on the other end of the phone who's paid for a contract to be on the phone. So if your child is sick at 2 o'clock in the morning and you're in pain, I mean, it's 2 o'clock in the morning. So first of all, your mommy doctor is a little, wiggly. So you're not sure, should I go to the emergency room? He's got a fever, he's throwing up, he doesn't look right. You pick up the phone and you say to a doctor on the other end, here's what's going on. What did he have for dinner? He asks you questions, and the doctor will actually give you some insight and say, you know what? Sounds like the flu. I've talked to 100 other people. Why don't you call me back in about 5 hours? See if you can get him back to sleep. Let's talk again in the morning. Or he might say, get him to the emergency room. He sounds very sick. Go now. One solution costs nothing. But if you're in panic mode and you take that child to the hospital, you could have just dropped $1,000. And if you have a higher deductible plan, it's nice to know if you're about to drop $1,000 that somebody was saying this is a good investment. You need to get out of here. Go. So telemedicine is a great option because it's somebody on the end of the phone who can give you really good advice for a very small fee. On a Sunday afternoon, you're out in the backyard, somebody gets hurt, stung by a bee, something happens. Do you need to go to an emergency room? Again, $1,000 option here. You know, they have nurse practitioners in places like Rite Aid and CVS, and they have walk-in care facilities where you could be seen by somebody who is very well trained, excellent at what they do, and may be able to resolve your problem for under $100. So how is insurance written? So what happens is, if you have a group plan, they take all of your claims history from last year. So this group of 20 people, let's say you spent $500,000. Well, we know costs are going up by 10%, so if you spend the exact same amount this year, you're going to spend $550,000. And there's an administrative cost to us at running this plan, which is about 15 or 20%. So it's going to cost you another $100,000. So there's $600, and there's your 20% increase. That's how you just got that 20% increase. So the only way you can control costs is if you change consumer behavior at the point of our behavior, our consumers. Our decisions can't be spoiled brat decisions that I want the best of care for absolutely everything under the sun at all times, because it's driving our premiums through the roof. Now, since everybody in here seems to have a car, I'm sure none of you have done this, but I've heard stories about people who might have had a fender bender or a ding in their car, and they didn't tell their insurance company. Why? Why would you not tell your insurance company?
You don't want your premium to go up.
Don't want your premium to go up, right? Homeowner's plan, same thing. You ever not file a claim because you don't want to be dropped? Right? This is what's happening with our health insurance. Rules of insurance are consistent across the industry. You don't have to tell your health insurance company every single move you make. Sometimes, if it's not that expensive, if you just want to fill a prescription, if you just want to take care of this, sometimes you call the doctor on the phone, you don't have to tell your insurance company about it. Then when they pull the claims history, if everybody modified their behavior and they became better consumers and they made some less expensive choices, instead of $500,000 worth of history, they'd pull up $400,000 worth of history. And boy, would they be suspicious. What did you people do? But that's true. That's how you lower your premiums, is you have to change the behavior at point of prescription. So I had a friend who went in, he had pulled a muscle, and the doctor ordered some blood tests. And he's like, well, what are the blood tests for? I have a pulled muscle. He's like, well, I want to get this. He says, well, what's that for? Well, it's an AIDS test. I haven't, we've never done an AIDS test on you. I'm like, he says, I've been married to the same person for 20 years. I don't recall having any blood transfusions. I don't want an AIDS test. How much is it going to cost? Oh, they run about $140 or whatever the cost is. No, thank you. You have the right to decide whether or not you have that blood test. I have a friend who was diagnosed with asthma. And she said to me, I read your book, I was totally empowered. And then I got this prescription and I asked the doctor, how much is this going to cost me? And the doctor said, oh, are you paying cash? And she said, I have a high deductible plan, I just want to know what I'm in for. And he said, it's a couple $100. You know what, let's try this option, it'll be about 12. So if you, at the point of prescription, if you engage, you begin to take back control. And so what happens for the person who says, I'm a little nervous, that I don't want the doctor to think I'm challenging them. I don't want to create an awkward situation. I'm going to tell you that from my experience, all those years I worked with doctors, they actually appreciate, A, that you are engaged in your own health care. It's not being just sort of dumped on them and left to their responsibility. And B, there's a much better chance that you're going to take your medicine all the way to the end, because right now you're showing me that you're an engaged consumer and you're concerned about your cost, and if you're investing this money, then you're probably going to use this medicine. So they're not insulted. For the most part, they're spending your money. You have a right to ask how much of your money are they planning on you spending. It's not an insult. You can control your costs, and throughout the book, this book is peppered with questions, reasonable questions, not insulting questions, just ask. Mr. Pharmacist, this is how much? Is there any other drug that is less expensive? Oh, this is a combination of 2 generic drugs? Well, what if I got the 2 generic drugs as 2 different prescriptions? Well, I have to call your doctor's office. That's okay. I don't mind if you call my doctor's office. Well, yeah, it'd probably be like 1/10 of the price. So you should be calling my doctor's office. I'll just be over there. If you engage in your healthcare choices, you can drive down your own costs. You have the power. It's your opportunity to take the power back.